This is special test of the foot and ankle part 2. Okay, so the first one is the single leg toe stance. You're gonna have your patient stand up. Then you're gonna have your patient stand on their foot. Go on your toes. They're gonna go on their toes, and if they can do that, they're gonna go on their toes and they're gonna hop, and you can support them. And if they can't do that, they could have a Liz Frank injury. Then you're gonna do the navicular drop test. So you're gonna have your patient stand up again, sorry. And you're going to have your patient sit, stand up to sit. Your patient's gonna sit down so their foot can be comfortably on the floor. Then you're gonna find the navicular tubercle. The navicular is like right here. And your tubercle you're gonna feel is like a little bump. You're gonna mark that little bump. And then you're gonna put a piece of paper and you're gonna measure where that bump is. Then you're gonna have your patient stand up and you're gonna measure where that bump is now. So hers is not very different, just a little bit different. And you're gonna look at those two lines. If those are more than 1 centimeter, there is an issue with your navicular. All right, we are gonna do the Supple Planus test, which your patient's gonna stand up and you're gonna look at your patient's arch. And you can see she actually has an arch when she's standing here, but if someone has a flat arch, it may look more like that. And you're gonna have your patient stand up on their toes again, just like you did in that other test, and you're gonna see if an arch forms. If the arch forms, then they do not have a supple pes plan, or they have a supple pes planus, which means, you can sit down, which means that they can have an arch, but if they had a rigid pes planus, then it wouldn't turn into an arch. This test can also be called the Windlass Test, but Windlass is also a different test, so we're gonna teach you both. So the second test that could be windlass is your patient's gonna scoot back. You're gonna have your patient bend their knee and sit with just their toe off of the ground, and you are going to dorsiflex your patient. And if your patient couldn't, not dorsiflex, big toe extension. If they can't big toe extend, it could be a hallux rigidus, or if they have pain on their plantar fascia, it could be a plantar fasciitis issue. Now we have the Dorsiflexion-Eversion Test. So dorsiflexion-eversion, you may think this is Kliger's, but it's not, because then you're gonna palpate. And if they have pain here, it's a tibial nerve injury. Very similar, but not the same. The next test is the star Excursion test. So you're gonna have your patient stand up. They're gonna go on their injured foot, and you would draw a star on the floor, and they would go like in a circle, and they are gonna go as far as they can and tap. And then they're gonna go like on a clock to 3, 6, 9, 12, whatever those numbers are. And you go in a whole clock, and then you measure to the other side, and if they can't go as far, that's a problem. You have, assessment of subtalar neutral is your patient's gonna scoot back. You're gonna stabilize the tibia and fibula. You're gonna kind of put your fingers just medial to the malleoli, and you're gonna dorsiflex until you hit resistance. And you can see like it's kind of where you can put your finger in like this divot up here at the talus, and that's just gonna be your subtalar neutral. You can also move the foot to see how much motion that they have if you take that neutral talus out of it. Valgus Varus MTP. So the metatarsal, which are the webbed, and the phalange. So if I am going to valgus my metatarsal, the distal part is going to go medial. So I'm gonna stabilize here, and you're gonna move the big toe in, or you could do it at any of the small toes, but that's a little awkward. So valgus, and then varus is, no, that's wrong. Yeah, so the distal part is gonna go lateral, which makes that go in. And if you forget, just do valgus of your knee. So the distal toe is gonna go out, and you're checking here on this MCL. And then if you go the other way, you're checking on the LCL. You could do that, so that's for the metatarsal phalangeal, but you can also do it for the little intermetatarsals, choop choop. And you just test each of them, and you're looking for laxity. Then you're going to have the heel raise test. So the patient's gonna stand up and you're just gonna make them do 25 heel raises. And if you can't, that's a problem. The spring test, scoot back for me. The spring test is gonna be similar to the compression test, or like the squeeze, but you're only gonna do it at one spot. So go just like where the Achilles tendon forms, like under the gastroc belly, and you're just going to push the tibia and fibula together, and you're looking for the malleolus to spread, and that would be an issue with that talocrural true ankle joint. Cotton's test, you are going to squeeze their heel, stabilize their shin, and you're trying to shift that calcaneus in, almost like you're doing an inversion. No, I'm going inversion, huh? I lied. So just kidding. You're gonna hold and you're gonna go eversion. So you're trying to pull the calcaneus laterally. Then you have, I lost where I was. Okay, intermetatarsal joint play, or the piano key test. So the metatarsals 1, 2, 3, 4, and 5. You're gonna grab 2 metatarsals and you're just moving them up and down. All the joint plays is just moving and you're literally just playing with the joints. So intermetatarsal or piano key is the metatarsal joints. Then you have the tarsometatarsal, so your tarsals are here, your metatarsals are here. So you're trying to move the tarsal bones on the metatarsal bones. Then you have midtarsal joint play. So say like this is the cuboid, this is the navicular, these are my cuneiforms. I could grab like a cuneiform and play with it, or the cuboid and the cuneiform and play with it. And then MMTs are manual muscle tests. So there's a few manual muscle tests that you can do for this unit. So the first is tibialis anterior. So you're gonna have them dorsiflex. The tib ant is this tendon that goes there. So you're gonna stabilize and you're gonna tell them to pull up against you, and you're gonna try to break them and go down. You're looking for like strength compared to the other side. Remember, that's graded 1 to 5, 5 perfect, 1 they can't do anything, 3 is they can do it against gravity, 4 some resistance, 5 is perfect resistance. So tibialis anterior is trying to plantar flex them, they're trying to dorsiflex. Tibialis posterior is going to be that they are going to go inversion and plantar flexion. So you can put them in that position and then you try to pull them out and up while they go in and down. Gastrocnemius MMT, knee straight because they don't have sole, knee straight, push, and then soleus is now they have sole, they could bend that knee and then try to push and do plantar flexion while they're plantar flexing, you're dorsiflexing. And then Extensor Digitorum MMT, your digits are your small fingers. So extensor's pulling them back. So you're gonna grab the toes and they're gonna pull their toes up. And then Extensor Hallucis is just the big toe. And then you have your Flexor Digitorum where they're gonna do the little toes, and the Hallux Digitorum, Flexor Hallucis, and that's gonna be the big toe. Peroneal is they are going to plantar flex and evert. So they're going like this. So you're trying to resist them going in that like upward motion. Ottawa ankle rules, you would just, do they have pain at the malleolus and can they walk 4 steps? If not, they need an x-ray. Or for the foot, do they have any pain in the midfoot? So like the tarsals? Do they have pain at the base of the 5th metatarsal? Do they have pain at the navicular? Or can they not walk 4 steps? So they need pain in the midfoot and one of the other things. So 5th met, navicular, or the 4 steps, in addition to the midfoot pain. The talocrural joint play is going to be where you're actually trying to move the fibula and tibia on the talus. So almost like you're doing like an anterior drawer and you're just trying to move that joint. Subtalar joint play is you are going to be pulling them laterally. So it's almost like cotton test, but you're not like having to squeeze as much, so you're just trying to pull them laterally as opposed to squeeze and pull them laterally in cotton. And then tibiofibular joint play is you're grabbing the malleoluses and trying to make them move on each other.